Hi and Happy New Year from a wet Dublin. It's 8 degrees here and most of you seem to be either skiing or sunning yourself somewhere exotic. I'm out on the exciting mission to get a new vacuum cleaner for the clinic. That's the level of my life at the moment, but I'm going to get a coffee soon. I just thought I'd look over some of the aesthetic medicine trends that I see happening in 2024. A lot of conferences I've been to in the last year or two have really been focusing on regenerative medicine, and that's where we use your body's own cells and repair mechanisms to improve the skin, to strengthen it, to build collagen, which is really the holy grail. As we get older, we're losing collagen, we're losing elastin, the skin is losing padding or fat, and it's also just becoming more crepey and thin. And we want the skin to be radiant, blemish-free. We don't want all these age spots, these splotches and blotches of middle age. So I think protecting the skin by using your own repair mechanisms is really exciting. And what does that entail? Well, the commonest of these is probably things like microneedling, and we love Skin Pen to stimulate collagen and to help repair the skin and reduce scarring and pigmentation. Another one that you may have heard about are polynucleotides. And these are little DNA fragments or amino acids that are extracted from fish DNA, and they can be injected into the skin or they can be worked in with a Skin Pen microneedling device. They are great for around the eye area where the skin is really thin and crepey and where we're often wary of putting fillers so we don't get puffiness. I had some recently on the back of my hands during a training event. I thought it was absolutely great. It's a little bit stingy, but with some numbing cream it's fine and really tolerable. Also, you can use it on the face, you can use it on the forehead, which sometimes we're a bit limited with treatment options for. You can use it on the neck and you can use it on the scalp. So I'm going to have some treatment next week. I'm going over to the UK to visit a pal and she's going to treat me and I'll treat her. So I'm really excited about that. So that's polynucleotides, and they tend to be different brands, but they tend to be extracted from salmon or trout DNA. They're suitable for people with a fish allergy, and you're not actually getting fish DNA material. These are extracts that have been purified. The way I think of it is we're also eating fish DNA or animal DNA if we are meat eaters. So if you're vegan, this is something you might not want to consider. Another regenerative treatment is looking at what are called exosomes, and these are little vesicles or little bundles, and they exist outside the cells and they help the cells communicate with one another. And these can be microneedled into the skin, again with something like a Skin Pen device. They are generally from two sources. One is plant sourced and one is human sourced. So if you're going to consider this, you've got to be really clear what is your stance on whether you want something to be human or plant derived, and my preference would be plant derived always. And the reason these are important is they just help the cells to behave younger, to act younger, and to transport materials into the cells where we need them. The basis of everything, of course, is a really simple skincare routine, and so I think people have become so much more educated in the last few years about collagen, about sun protection, and I see that trend just continuing over time, which is wonderful. PRP is another form of regenerative medicine, and this has been around for several years. It's used in sports medicine, it's used in veterinary medicine, and essentially we extract a sample of blood, about 2 teaspoons worth, and then we spin it in a centrifuge to extract growth factors, which we then can either inject in under the skin, or we can put in with a cannula or a needle, or again we can microneedle into the skin or the scalp to help give those raw materials to the cells and help them work better. Another area of regenerative medicine is really what are we doing with our own diet? Are we eating a blend of good protein? Are we eating good fats? Are we taking any fish oils or any omega-3 supplements? And particularly in Ireland and other Western countries, we're often very deficient in vitamin D. So you can ask your GP to do a routine screen test and check your vitamin D levels. And the vitamin D supplements are cheap and easy, and they really do make a difference. Vitamin D is critical for so many hormone and other functions, and it's a vitamin we can be short of in countries where we don't get a lot of sunlight. But I would expose my skin to sunlight, particularly arms and legs, for just 15 minutes a day, but I'm really careful about protecting my face and neck and hands with SPF because I don't want to accumulate wrinkles or pigmentation or premature skin aging there, but I do want my vitamin D, which we get from sunlight. So definitely worth checking your supplements. Another trend I'm seeing a lot more is an emphasis away from just the regular 3 areas of toxin, which is botulinum toxin, and an emphasis on combining that with lower face toxin, which is really giving all that pull down on our faces here. So that's a trend. Another trend is to absolutely have fillers, dermal fillers, as a good tool, but not to just rely on them to fill and fill and fill. So I think the trend globally is that fillers are reducing, and I think that's a good thing. But I use them every single day in my practice, but I just use them really carefully and cautiously and subtly. Another way to regenerate collagen is to inject it, and there are various injectable products like Harmonica from Allergan, like Sculptra, like Elance, and all of these can help stimulate collagen over a number of months, and they can be really good options as well. So talk to your provider about that. As always, if you're going to seek an aesthetic medicine treatment, please see an experienced provider who's got medical training. And to me, I would only go to a medical doctor, a dentist, or an aesthetic nurse, because I believe they have so much more training and anatomy knowledge, and their registration is important to them as well. So for me, I only seek treatments from my own colleagues, and I don't treat my own face. I seek the expertise of somebody else, and I'm cautious. So I hope you all have a wonderful 2024, and feel free to get in touch with any questions. Take care. Bye.